Admitting you were wrong for 20 years is hard, especially when you're a doctor, when people trusted you with their health, when you considered yourself an expert. But I must do this because staying silent would be dishonest. 20 years ago, when I just finished residency and started practicing independently as orthopedic surgeon, I was confident I knew everything about knee pain. I had excellent education, prestigious hospital, all modern technologies. I could read any MRI, perform any surgery. I was convinced I followed best medical practices, but I was wrong, fundamentally wrong. And today I'll tell you exactly how. It all started with simple protocol I was taught, and all my colleagues followed. Patient comes with knee pain. I conduct examination, order imaging, X-ray, MRI, get results, see problem on scans. Here's meniscus tear. Here's cartilage thinning. Here are bone spurs. And I thought, this is pain, cause my task. Fix this structural problem. Surgically if needed, or conservatively, injections, pills, physical therapy. I focused on structure, on what I saw on scan. Most of my patients got relief. Some recovered completely. I considered this confirmation my approach was correct, but there were others. Those who didn't recover, those who returned 6 months later with same pain or new problem, those for whom I performed technically perfect surgery, but result was unsatisfactory. At first, I explained this through individual characteristics, unfavorable disease course, non-compliance with recommendations. I didn't allow thought that problem could be an approach itself. Turning point happened about 10 years ago. I was conducting research, analyzing long-term results of my surgeries, and stumbled upon disturbing statistics. Approximately 30% of patients I performed arthroscopy on for degenerative meniscus changes had same or even greater pain 3 to 5 years later than before surgery. 30%. This isn't just statistical error. This is sign something's wrong. I started digging deeper, reading research I previously ignored because it didn't match my beliefs. One study particularly struck me. Scientists took a group of people with knee pain and degenerative meniscus damage on MRI. Half got real arthroscopy, entered joint, removed damaged meniscus part. Other half got sham surgery, just skin incisions, procedure imitation under anesthesia, but didn't enter inside. Results were shocking. Both groups showed improvement, approximately same improvement. Real surgery group showed no significant advantage over sham group. This meant only one thing. Most improvement was placebo effect. Surgery itself, meniscus part removal, wasn't what helped people. What helped was belief in treatment, doctor's attention, post-procedure rehabilitation. This was blow to my ego. I performed hundreds of such surgeries, was confident I was helping people. Turned out in many cases I was just conducting expensive placebo procedure with surgical risks. I could have dismissed this study, found reasons why it doesn't apply to my practice. Many colleagues did exactly that, but I couldn't because when I honestly looked at my statistics, they told same story. I started rethinking everything I was taught. If structural changes on MRI aren't always pain cause, then what is? I began studying biomechanics, functional anatomy, pain, neurophysiology, and gradually picture started clearing. Knee pain in most cases isn't structure problem, but function problem. It's not broken part needing fixing or replacing. It's disruption of how entire system works. I started changing my approach. Instead of immediately looking at MRI, I began first observing how patient moves, how they walk, squat, stand on one leg. I started checking not just knee, but hip, foot, back, checking muscle strength, flexibility, balance. And you know what? I started finding real pain causes, weak glutes, not stabilizing pelvis, tight iliopsoas, changing biomechanics, wrong movement patterns, creating excessive knee load, foot problems, transmitting wrong, load up the chain. And when I started treating these functional problems, strengthening weak muscles, stretching tight ones, correcting movements, results were astonishing. People who suffered months or years, whom traditional treatment didn't help, started recovering. without surgeries, without constant injections, simply through restoring proper function. There was a patient, let's call him Michael, 62 years old, came to me 5 years ago with severe pain in both knees. MRI showed moderate arthritis, cartilage thinning. 20 years ago, I would have told him, you have arthritis, it's a degenerative process. Here are chondroprotectors, here are anti-inflammatories when it gets really bad, joint replacement. And Michael would have lived rest of life with pain or with artificial joints. But I'd already changed. I watched how he moves. His gait was disrupted. He walked with stiff knees, barely bending them, all weight transferred to front of foot. When I checked his muscles, quadriceps were atrophied, glutes barely activated, calf muscles were hard as rock from constant tension. His body developed compensatory movement pattern to avoid pain, but this pattern created even greater joint load. We worked 4 months. Exercises for strengthening quadriceps and glutes, calf muscle stretching, gait retraining, how to properly transfer weight, how to use muscles to absorb load instead of everything falling on joints. This wasn't easy. At 62, relearning to move is hard work. But Michael was motivated because in first month, he already felt difference. After 4 months, pain decreased by 80%. After a year, he was hiking, playing with grandchildren, living full life. His arthritis, visible on MRI, didn't go anywhere. Cartilage didn't magically restore, but there was no pain because we fixed function. His knees stopped receiving that destructive load causing pain. If Michael had come to me 20 years ago, I would have missed all this. I would have looked only at his MRI, seen arthritis and treated arthritis, not seeing that arthritis was consequence, not cause. Consequence of decades of wrong movement, weak muscles, disrupted biomechanics. That's where I was wrong 20 years. I thought knee pain is knee problem, that if scan shows something, that's the cause, that my task is fixing structure. But truth is, knee is part of system. When system works wrong, knee suffers. It's just in middle of kinetic chain receiving consequences of all imbalances above and below. Treating knee without fixing system is like constantly changing car tires without fixing alignment. New tires will wear unevenly, same way. I'm not alone reaching this understanding. More and more recent research shows same thing. That functional approach, focus on biomechanics and muscle strengthening, is often more effective than surgical intervention for chronic knee pain. That many surgeries we routinely performed actually aren't needed and aren't effective. That old see structural problem, fix it model is too simplified. But changing medical practice happens slowly. Many colleagues still work by old protocols, not because they're bad doctors, but because changing what you were taught, what you did for years, what you invested your identity in, this is very difficult. This requires willingness to admit you were wrong, and that hurts ego. It took me 10 years to fully accept this and change my practice. Another 10 years practicing new approach to be confident it works. And now looking back at these 20 years, I see so clearly where I was wrong. How many people I could have helped better if I'd known then what I know now, but I can't change past. I can only change present and future. I can share what I learned. I can teach young doctors to look broader, not fixate on scans, see person as system. I can tell patients that knee pain can often be treated without surgery if you find and fix real cause. If you're currently suffering from knee pain, if you're told you need surgery or that it's just arthritis, nothing can be done. No, there's alternative. Find specialists practicing functional approach. Who watches how you move, not just what MRI shows? Who's ready to work with you on strengthening, stretching, movement, correction? This requires more time and effort than taking pill or getting shot, but it works, really works. Admitting I was wrong 20 years is hard, but you know what's harder? Continuing doing what doesn't work, knowing there's a better way. I can't do that anymore. I was wrong, and I admit it, but now I'm doing everything right, and it was worth it.